Y'all, thanks so much for joining. Happy New Year. It is a new year. So I know we haven't talked to you all in a while, so we wanted to host the briefing this morning to be able to answer your questions, give an update on COVID-19, as well as we know there are a lot of questions out there about vaccinations. So with that, today we've got Warner Thomas, our President and CEO for Ochsner Health, Dr. Robert Hart, our Chief Medical Officer, and Dr. Catherine Baumgarten, our System Medical Director for Infection Control and Prevention. I know y'all have spoken to a lot of them over the last several months. So with that, I'm going to turn it over to Warner.
Great. Thanks, Nicole.
You're welcome.
Good morning, everybody, and sorry for the delay. Just a lot going on these days. So we wanted to give you an update. You know, certainly we are seeing a third surge here in Louisiana. We're kind of seeing across all of our facilities across the region. So we can give you an update on that. We can talk about the vaccine and certainly talk about anything else that's on your mind. So today, you know, we have probably about 540 patients, and with LGH, I think LGH is about 100, so about 640 across all of our facilities. I think that's more than doubled in the past month. So we've seen a very big escalation, especially in the last 10 days, including I think over the weekend, probably, 40 to 50 patients a day, increase. So I think what we're seeing is the impacts from, first Thanksgiving. That was some of the escalation in December. And now I think they're seeing the escalation from holiday parties right before, Christmas, and then obviously Christmas and, probably another week, New Year's. So we are concerned about it. We're seeing, significant volume in our ERs, significant volume in our urgent cares. So that's what's happening there. As far as, and we can talk about ICU capacity and bed capacity. We feel like we're in good shape today, but we are continuing to, look at bed expansion and, look for opportunities to move patients should we need to different, facilities in our system. The vaccine is going very well. We'll give you specifics on that. I know Kathy and Robert can talk more detail about the vaccine, but as far as the vaccination of our employees, I think we're just under 50% of our employees have been vaccinated. We are seeing tremendous demand from the over 70 population that is seeking the vaccine, and we have got a very organized approach of people getting registered and getting times to be vaccinated, and really getting that booked over the next couple weeks. I think we are, Robert, just confirm the numbers for me. I think weekly we're looking at about 16,000 roughly for the week, and I know that we're now working hard to try to we're trying to expand to 25,000 next week. I was talking to our chief operating officer this morning, and we're looking to expand and grow to 25,000 appointments next week. And we'll be working with the state to make sure we get the right vaccine dosages so that we can adhere to that. So, Nicole, I don't know if you want to just jump into questions, or Robert or Kathy, I don't know if you have more updates you want to give on vaccine or on cases. I mean, why don't you guys make a few comments, and then we can certainly open it up if you want.
Yeah, I'll just add that you're right. We've basically doubled our COVID volumes across the system in a month, and just in the past 2 weeks, it's up about 200 patients across the system. Actually, probably about 250 when you count Lafayette General. So significant rises this past week has certainly seen that same kind of increase. And I agree with Warner. This is, if you look at the timing of this particular disease, this is not even the Christmas spike yet. This is all of the pre-Christmas holiday parties that we know were going on. And so we still have Christmas and New Year's ahead of us. And that's what, and frankly, that's what has us concerned. And I think that's what the public needs to understand, is that we're seeing the holiday parties now show up. Christmas and New Year's haven't hit yet. And so we know that it's going to get tighter. And so we're making adjustments for that. But it is going to be a tough January.
Kathy, any thoughts?
I completely agree with Robert. I'm concerned about the 2 to 4 weeks following Christmas and New Year's. That's typically where we see the rise in hospitalizations, at least. We start to see the cases, in the first 7 to 14 days, but then people start to become more ill over that next week to 2 weeks. So typically there's a 2 to 4 week lag for what we're seeing in the hospitals. And certainly over the past 2 days, we've had the most patients over the past 2 days that we've had across our system. So of course, we're ready to handle it. We're prepared to handle it. We have units that are opening to take care of patients, but we want to continue to share that message that people need to continue to wear their masks, social distance. And the CDC has really commented over the past few weeks that the smaller social gatherings are the places in which people are still at most risk for getting COVID. So when you let your guard down in a small gathering that's not your own group of people, that's where it's spreading. So please continue to share that message with the public. We'd appreciate it.
And I think that's what we're hearing from patients that are testing positive and ones that are being hospitalized. It's and I got asked yesterday. I mean, this isn't about people going into restaurants and things like that. I think restaurants are adhering to the protocols, making sure people are wearing masks when they're in there. It's private parties. It's folks that are having folks over to their house, and then they take the mask off, and one person has COVID, and then boom, you've got a spread at a party. So I think these are a lot of private functions that are driving this, and we've just got to have folks be extra careful as we go through this. But right now, we've probably a lot of that damage is already done. It's just, are we going to see how much is this going to escalate over the next couple of weeks? And we are preparing for this to keep escalating. We have not seen levels of this patients since probably back in April. And so it is, and the speed over the past couple of weeks, as Robert indicated, has been pretty significant. So Nicole, maybe I'll just stop there, and if there's questions or, we're happy to dig into anything that would be helpful for folks that are on the line.
Yeah, and I think what would be helpful is, why don't we have questions first about general COVID update, bed capacity, staffing, surges, and then we can go to vaccines. So why don't we take questions first on general, what we've just been talking about in terms of like our current numbers of inpatients and what we're seeing in our facilities. So if y'all could start with that first, just make sure to unmute yourself.
Are you seeing a change in the ages of the patients coming in who are testing positive for COVID?
Robert, I guess, I think if you compare back to when we saw this, early on back in March, April, I think we're seeing a younger patient. I don't know if we're seeing any difference today versus 2 months ago.
We've been looking at this monthly, and actually the initial patients that we saw back in March and April was definitely an older population. And then, as you all remember, it swing to a much younger population there in the late spring, summer. But I would say over the past 4 months, we've been looking at this, and it is a really kind of a bell curve across the 30 to 70, 30 to 80 age group range. And it's been pretty static for the last 4 months.
Hi, good morning. It's Sabrina Wilson at Fox 8. On staffing, is Ochsner enlisting the help of retired doctors and nurses during this time, or do you anticipate that?
We have not reached out to retired doctors or nurses. We are, working with our staff to, we do see people working, overtime, extra shifts. We have brought in some traveling nurses from outside of Louisiana, and that has ramped up even further over the past couple of weeks. We're continuing to look for more staff. But at this point, part of our plan is not to bring retired nurses and physicians back. So I think we are looking, as we look at vaccinations, we're looking at how we can use, folks that may be volunteers or maybe nurses that are lighter duty or towards the end of their career that could, work in some of those functions, because we know we're going to need to staff a lot more, vaccine locations and have a lot more, I guess, for lack of a better term, areas, more where we can do the vaccine at these locations, try to enlarge them. But Robert, I don't know if you have any thoughts about that.
Yeah, I think we have been able to redeploy some of our physicians within our system to do some things that maybe not in their everyday routine, but they certainly participate in these activities on some regular basis. Similar to a little bit what we did back in the spring. For instance, we have anesthesiologists that are all critical care trained or did extra training in critical care. Well, they can help us. They can help us with critical care patients. And so doing things like that, again, we haven't reached out to retired physicians at this point.
It's Aubrey at WDSU. Hope y'all are doing well. Wanted to triple check I had my number correct. 640 COVID patients across Ochsner facilities across the state, correct? And is Ochsner concerned about running out of bed space during the month of January and February and going into the next couple weeks and months?
Yeah, so that number is including Lafayette General, Robert, would be correct, the 640, is that right?
Yes, yeah, we're hanging right around 630 to 640 if you include Lafayette General. Yes.
Yeah. So I would say that I wouldn't say that we are worried about running out of bed space. I would say that we are preparing to put more beds into service and looking at opportunities to move patients, should this continue to escalate. But, we are managing this with continuing to take care of other patients who need services. We have made suggestions to the state, and I think they understand this, that we do not want to just shut down procedures. That is not good for other patients. So we are managing this surge and still taking care of our normal patient load. But it's certainly something that is a challenge, and we are building contingency plans on how we need to continue to expand and grow bed capacity if we need to.
Hi, this is Emily Woodruff with the Times-Picayune Advocate. Are surgeries scaling back in any way, especially those that require overnight stays and extra beds? And are all facilities still taking transfers?
So we have looked at dialing back at our Ochsner Medical Center some transfers that are out of state. In the past couple of weeks, we've had requests to take patients from Oklahoma, Arkansas, Georgia, and we have not taken those transfers. So we have had to dial back some of the external transfers. And then I think Robert, you can hit the details. I know on some elective cases, we are, delaying those slightly, but not a major movement at this point in time. Right.
And actually for the last 2 weeks, we've been asking our surgeons to at least calculate, those surgeries that might need inpatient beds versus being done, day surgery. We've not had to, knowing that the volumes were going to go up. Now what we've done, and we were able to move some of those surgeries over to our Elmwood facility and do those to free up beds here at ONC. The other thing that we've done now is then we began to ask our surgeons to look at, okay, if you're going to do an inpatient surgery, make sure that that there is a bed available for, in other words, might be freeing up a bed from one of your patients that you're sending home so you can do a surgery here. Asked our surgeons for next week to begin not scheduling anyone that they might see in the office, except for emergencies, keep that in mind. But next week to not be scheduling someone for surgery over the next couple of weeks that might need an inpatient stay. So we've just put that and asked them to begin to look at that for next week.
And I think, yes, these would be things that we feel could be delayed, safely. I mean, certainly if there's any emergent issues or things that require, more immediate attention, we're taking care of those folks timely. I did get a couple questions handed to me. One is just a question about community testing. We are still doing community testing. I believe we've got 14 teams around the state that we keep doing community testing in lots of different locations. We deployed these teams back in the May-June timeframe, and they've been working every week to test people around the state, either hot spots where we see escalation of cases or what we call blind spots where we're not seeing a lot of testing done. So that is continuing. And, there's been a question about, vaccine hesitancy among employees, and do we view it as a problem? I'm going to say it's a problem. We are going to have a big push in the next couple of weeks to make sure we are promoting all those that have gotten the vaccine from all disciplines in our organization, including leadership, including our physician leaders. I know Kathy has been, out there showing herself getting her vaccine. And Robert, I don't know if we got you on video, but, we got to make sure we do that, get you out there getting your vaccine. But Leo Swanee, our Chief Academic Officer, Deb Ford, our Chief Nursing Officer at our Ochsner Medical Center campus, they have been, vaccinated on camera, and we've been promoting that, and we're doing that at all of our locations. But you'll see a big push in the next couple of weeks to try to get another wave of our employees vaccinated. As I said, just under 50% today. And I think some people, for whatever reason, waited to get through the holidays, and so we are, seeing more every day. Even from the 1A and 1B that are getting vaccinated. But, this week on Monday, a couple of days ago, we started the second vaccination for the folks that got their first vaccination back on December 14th, 15th. So we are starting the second shot for many people this week as well.
Yeah,
Hi,
and I'll add.
Oh, go ahead. I'm sorry.
Yeah, I'm just going to add on to that. I think actually I've been pretty pleased with our response compared to other systems across the country. The other thing that we're seeing right now is we've just started. Keep in mind the second shots to many of our employees. That just started on Monday. So there was a group of our employees who we're kind of taking this, let me wait and see how that first run goes. And now that people are getting their second shot, there is kind of this collective sigh of, okay, well, now we can go ahead and do it. So I think we're going to begin to make a push, as Warner said, but I think the other thing is just that anxiety level now that people are getting the second dose. For a lot of our employees are saying, okay, now I've seen it, I'm ready to go do it. So there seems to be a lot more positive response towards it.
And I know there's a question that came up, are we offering financial incentives for people to be vaccinated? We're not doing that. We're just saying, we will strongly encourage it. We're going to keep encouraging it. We're going to make it easy, as we have in the past few weeks, for our employees to get vaccinated. So, but I do not see us offering financial incentives for people to get the vaccine.
Hi, it's Sabrina Wilson again at Fox 8. I have two questions on the vaccine. One, is the Ochsner Health system only administering the shots to Ochsner patients? And the second question is your thoughts on access to the vaccines that your system needs. Last week, LDA said sometimes hospitals don't know until the morning of. If you could address that, please.
Yeah, so I guess, go ahead, Robert.
Go ahead. I can take some of that. I know that there were 107 pharmacies, I believe, around the state that got doses of vaccine to begin doing the general population. We have been with the doses that we've got, we were rolling it out to our patients. Again, there's a registration process. We've got all those patients in our system here. So we were trying to do this in a very efficient manner. I think we all understand that time needs to be considered in all of this, because the more people we get vaccinated, the sooner we get out of this pandemic and can go back to a more normal life. And so within our system, the allocations we've gotten, those we've been using those on our patients, but out in the pharmacy, those are for anyone.
And can I just add that our pharmacies are giving it to non-Ochsner patients too. So we do have dedicated pharmacies that are giving it to both Ochsner and non-Ochsner patients.
Right. And again, that's to those patients that still are in that criteria, 70 and above, 70 years old and above.
I've heard from several
And
patients.
I'm sorry, and on the point of getting the vaccines you need in a timely fashion, again, LDH indicating that hospitals sometimes are finding out the morning of the delivery.
Yeah, so we have had some deliveries that came a few hours late, or we weren't sure exactly when they were getting here. I can tell you though, that hasn't affected our administration or processes here. It can sometimes create a little confusion on when you're expecting it, but I will say, because we have some of the ultra cold storage, we're able to accommodate that and move along. So it hasn't slowed down. I think the point maybe you were getting at, has it slowed down the administration? And I would say no, not for us anyway.
Hi there. I've heard from several patients who said they called Ochsner pharmacies on Monday and they were told they could not receive vaccines. Was there a misunderstanding that has since been corrected? Because it sounds like now you're saying that they can get those vaccines at Ochsner pharmacies regardless of whether they're a patient.
So I think yesterday there was a call with LDH, exactly what you said, to clarify. So for the pharmacies, it's all those patients over the age of 70. And so that, I think there was a clarification on that for you. Yeah.
Yeah. So there was a miscommunication on Monday about that. That's been corrected and taken care of. And, once again, in our database, we have identified about 205,000 patients who are over 70. So what we've been doing is we sent out electronic messages to many of them over the weekend, but we're doing it in waves because we didn't want to get flooded with 205,000 appointments when we only have 10,000 vaccines. So we've been doing that in waves, but if folks are calling, we're getting them scheduled, but we're having to do it in a controlled fashion, knowing that we can't do everybody in week 1 and week 2. And we are doing it in kind of a pre-registration, a scheduled time, so people don't have to come in and have long waits. I mean, they'll have an appointment time, and I think it's happened in a very orderly fashion. But yeah, I think there's been, we've gotten calls from folks who, well, I didn't get the email about the vaccine, and I'm over 70 and I go to Ochsner. Well, that could be because they're not in the first wave, and we just really have been doing this in a very organized fashion. But if folks, need it, call up. We're trying to get them scheduled as soon as possible. And I think the state's assured us that as we get people scheduled, they will make sure we get the vaccine. They are not going to let us run out of vaccine dosages. To the extent we get more people scheduled, they'll make sure we have the right supply to take care of patients.
How many Ochsner employees have been vaccinated? The number percent of them, and we had some of you reach out to us asking about the if Ochsner Fitness Center employees were vaccinated. A reviewer reached out to us asking about that. Has that happened?
Yeah, they've been offered the vaccine as well. We have vaccinated several of those. Are you talking about members or employees that work at Ochsner Fitness Centers?
Employees, or unless members have been vaccinated.
No, I mean, we have offered that to the employees there. We have about 32,000 employees, 33,000 employees across our system. We've vaccinated, Robert. I think it's a little over 16,000, roughly.
Right. Just running up on 17,000 now. And like we said earlier, we're about between 46 and 50% of our employees are getting the vaccine.
You said 16,000 so far have been vaccinated?
Well, 17 now, it looks like.
So 17,000 employees vaccinated. And how many patients have you all vaccinated so far?
Oh, I'm sorry, Aubrey. The 17,000 is the total that we've given thus far. So we'd have to break out the employees. The employees are probably about 16.2, 16.3, probably.
Okay. So 16,000 employees.
Yeah.
Just to make sure I have my math right.
Yeah.
16,000 employees vaccinated. And how many patients?
Several thousand. I mean, we're doing it every day. So we started this on Monday. So probably.
Right. I would say probably above 1,000 now. If I just do from 16.2 to above 17. So you're probably looking at about 1,000.
Yeah. It's changing every day because we're doing 2,000, plus a day, now. And that's continuing to ramp up and get larger each day.
Hi, this is David Mitchell with the Advocate newspaper in Times-Picayune. Can you just characterize for me, we've heard a lot of what you're doing. At what level of your capacity to deliver these doses are you? Can you just sort of characterize, like, are you at full guns now? Or do you feel like you could bump it up 25% more, 50% more? And what would it take for you to do that? Separately, could you speak to whether you're doing any genetic testing in relation to people with the virus, and have you detected the more virulent strain among your patients?
So I'll say that we're looking. We certainly have more capacity to ramp up the delivery, especially now that we've seen what the demand is when we opened it up to this over 70 group. So we're looking at other possibilities, other venues, other ways that we can ramp up the delivery. As Warner said earlier, can we get up to 10,000, 12,000 a day, even higher than that? Can we bump it up to 25,000 perhaps? Again, time is important here. And so we want to make sure that we can get as many people vaccinated as quickly as possible. But again, staffing, we're trying to staff the hospitals and staff these, the vaccination clinics. So we're trying to manage both of those.
And I would say that we are building models right now to significantly ramp up our ability to vaccinate more people, figuring out locations that we could do that, where we could run this on a much bigger mass scale. So that is underway, and once again, be predicated on getting all the vaccine from the state, and we've been assured that we can get more. So we are building those models and working with LDH and the state as we have the ability to ramp up vaccination capacity, that we can get the vaccine to give. So that's happening conjointly right now.
Do you see yourselves having any constraints to meeting those, whatever those models show? Like, do you need more people?
We need more people. We need more people. I mean, and as Robert said, we're redeploying physicians out of certain roles into the hospital. We're also looking to all of our clinics. We have 140 health centers across the state. We're looking to redeploy people out of clinics into the vaccination process to help us, process and give vaccinations. So we are looking at those capabilities right now to redeploy people to scale up and grow our ability to vaccinate people.
Do you foresee a need to bring in the Guard or somebody like that to start administering, some outside source?
I think that's up to the state. I think we'll leave that up to them. I think we're looking to ramp up our capacity to be part of the solution for the state to the best of our ability. I do think, frankly, I think healthcare systems and or providers doing this is probably better. I think you're going to have better uptake from patients if they're getting it done from a health system versus the National Guard. That's just my personal opinion. So that's why we want to be part of that solution to ramp up as much as possible.
In the virulent strain, have you detected that in any of your testing? And I'm sorry to hog all the questions. I'll go away.
Robert, I'll let you take that.
Kathy, you might have an update there. I'm not aware that we've done any genetic testing.
No, we don't routinely do any genetic testing.
Thank you.
I got a couple questions. So I got one question, clarify why we start with Ochsner patients first versus everybody that fits the criteria. Really, it was just because these folks are registered in our system. It's the easiest way that we could communicate with them is orderly for us to be able to build their ability to, schedule their own appointment to come in for a vaccine. So we need to start somewhere. We wanted to get it done as soon as possible. So we started where it was the easiest to do that. So that was the rationale behind that. Any talks of mandatory vaccines for employees? No, we're not talking about that now. We are going to continue to go through education, strongly encouraging, and as I said, every day we're seeing more of an uptake from people, and I think that will continue to grow in the future.
When can more elderly people expect to receive their vaccines?
We're doing more every day. I mean, we're booking patients over 70 every single day. That's ramping up every day. We got patients. We got people over 70 getting booked throughout this week and into next week. So that's going to continue to grow. As we continue to expand our capacity to do vaccinations. So every day that's getting to be a larger number.
Is it elderly people who are not Ochsner patients able to receive the vaccine?
Yeah, as I was saying, yes. I mean, we sent the message out initially to Ochsner patients, but if folks, we will vaccinate people who live in Louisiana who are over 70, meeting that criteria. We are working to get them registered and scheduled as well. So as I said, we started with our patients that are as part of our Ochsner database because it was easier and faster to go that route, but we're vaccinating anybody in the state over 70. It's just easier to start with the folks that are already registered in our systems.
Do you know how many doses are available for those over 70?
In the state?
Yes, currently in the state.
I don't know. I don't know what the number is in the state.
Hey guys, can you hear me?
Robert did.
No, I don't know how many are in the state. And again, the governor has said anyone over the age of 70. So we are trying to work through, again, our patients that are over 70 by notifying them to try to keep this in an orderly fashion. Obviously, a lot of people heard the governor's discussion last week about opening up to 70. So we got an awful lot of calls, to Warner's point earlier, saying, hey, I wasn't notified yet. But we're trying to stagger that a little bit to make it more manageable, because what we're trying to do is avoid what my relatives in Texas had, where they were outstanding in a line outside for 2.5 hours waiting for their vaccine. So this allows us to manage it much more orderly. It's a much better experience, keeps as many people as possible from not gathering all together in one place to get their vaccine. So that's part of the reason as well.
I have a question about the vaccine. Can you hear me?
Yes.
Okay, so, and I know you just mentioned the whole thing about in other states, particularly Texas, elderly people being in long lines waiting to get the vaccine. What have you guys seen with the supply that you've been given? Also, starting with the employees you have, giving them that particular vaccine and the one now for those 70 and older, have you guys seen it to where you have people sign up and they come to get the vaccine, but you've run out? Or has it been a situation to where not enough people have signed up and you've had to put the vaccine back, or some situation like that?
We have not run out of vaccine. I think we're really trying to, that's why scheduling is important so that we know how many people are coming at which time. We can have the vaccine there. It's ready to go. Robert or Kathy, you guys can comment on whether we've had to, restore vaccines, that sort of thing.
No, I think you're asking a great question because this vaccine is logistically challenging, just with the ultra cold, that sort of thing. So I think everyone is trying to be as careful and thoughtful about how they use it and how they distribute it. So we have not had any situations where people showed up and there was no vaccine. And it can be out of the ultra cold for a certain amount of time. So if we have that vaccine, obviously, we make sure and use that during that time period. So we have not run out of vaccine. So that's a good thing. We're trying to, but again, that's why we're trying to schedule it so we know exactly how much vaccine we need, when, and where.
We are really trying to avoid I'm sorry, Kathy, go ahead.
It's okay. We really have, that's one of the reasons that we started with, the reason we started with our employees is that's what we were supposed to do, but we were able to really fine tune that mechanism and make sure that we're not wasting vaccines because it's precious. So we don't want to waste any doses. And that's why we do schedule the appointments, and it's a very efficient process. Our employees have really been thankful and let us know how thankful they are that it's worked as well as it has. And we want to continue to offer that to others that need the vaccine as well. And we don't want to waste a precious resource.
Correct.
I have a question about something you mentioned earlier. You talked about how a lot of your health workers are kind of hanging back and not getting the vaccine immediately and waiting to see how their coworkers do. As we've seen after rolling it out to people 70 and older, there are thousands of people in Louisiana who are willing to get it immediately. So I'm wondering, why did we wait for 3 weeks? It became clear that a lot of these workers weren't going to get it immediately. Why didn't we do this weeks ago and start giving it to people who were going to take advantage? Because this seems to be the story of why Louisiana has been slow out of the gate to distribute and administer the vaccine.
Yeah, I wouldn't say that necessarily Louisiana is slow out of the gate. I would say that, basically, the idea of getting healthcare workers done first, I mean, we're talking a couple of weeks. So, we started with, folks over 70, this week. I think it's always easy to kind of sit here and look backwards and say, well, how would we have done the planning differently? But I think the state has done a good job on this. I think we wanted to make sure there was an opportunity to get healthcare workers done. Nobody knew what the uptake would be or not be. It was something that could not get projected. So, we gave our first dose on December 14th. And then, 2 days ago on January 4th, we gave our first dose to, patients over 70. So I guess you could say, could you have done it 1 week earlier? Maybe. But once again, we're not talking about weeks here. I mean, this just, we're only in, kind of the third week of this entire process.
Warner, can I clarify something too? I mean, our appointment schedules have been full even with our employees. So I don't see that we've wasted time or wasted vaccine. We have been proactively scheduling our employees and using every slot, every available time that we have to give the vaccine. And so if we had done this earlier, we wouldn't have had available slots to give to patients, honestly. And plus, we were following the guidance from the state and the governor. And as soon as the governor gave us the go-ahead to start vaccinating patients, that's when we did so. So we've really been proactive about getting our employees in and filling those slots. So I don't want to leave you with the impression that we haven't been vaccinating or filling the slots that we have available. We have been. Our employees have been showing up, filling in those slots and getting it done.
Yeah. And
we've been excited about it. I mean, they really have been. The employees that have gotten it have been so thrilled. I mean, it's really created a sense of hope, especially when we're seeing this surge. We need something to give us that sense of hope as healthcare workers because we've been doing this for a long time now. And so it's really provided some relief and some positivity among our employees. So I just want to make sure that that's understood. We have a lot of employees that are so grateful to have the vaccine and to be given it.
Yeah. And I would say we engaged in a very constructive conversation with the state, middle of last week about expanding this to patients over 70. They were very open to doing that, which is, I think it's that dialogue was just a day or so before the governor announced going to 70 and over. So I think we're trying to keep that constant dialogue going and try to give them information on what we're seeing on the front lines, what's happening, so that they can continue to modify and change policy appropriately as we go through this process.
How many doses has Ochsner received so far from the state?
I don't have that number, to be honest with you.
We'll get it for you, and we'll have Nicole make sure we get that circulated to everybody on the call.
Yep, so we'll get that to you. And I see that it's noon. I know we've had a ton of questions. Are there one or two left?
Yeah. This is Philip Kiefer at the Lens. I'm wondering if Ochsner hospitals, like apart from the pharmacies, have received any doses allocated specifically for people in 1B groups, or if all of the doses that you're giving out to those 70 plus patients are excess from the prior allocations. I've been hearing from other hospitals that they believe that they've received specific 1B allocations and want to know what that communication looks like on your end.
I mean, we've moved through 1A, 1B, and 1C, and now we're into, the 70 and older. And it doesn't mean that somebody coming this week that's one of our healthcare workers that's a 1A is not going to get vaccinated. We're going to vaccinate them. So I think as we saw the demand drop, we went to 1B and then, went to 1C. So it's been a dynamic process over the past several weeks. So I don't think it was that, okay, well, this specific dose is a 1B dose and this is a 1C dose. And it's not how we looked at it. We evolved this process over the past 3 weeks. So that's just not that's not how we manage that process. And I think, other hospitals may have taken a little bit of a different approach, but we wanted to keep, vaccinating as many people as possible, as quickly as possible. Which is what we're doing now in the 70 plus. And as our other 1A, 1B, 1C healthcare workers come forward, if they didn't get vaccinated 2 weeks ago and they want to get vaccinated now, then we'll make sure that we're getting that done and taking care of them.
Well, I'm sorry, I should clarify. I'm using 1A and 1B to refer to the state's priority groups, where 1B tier 1 is the 70 plus group of people following healthcare workers, as opposed to the 1B, 1C that you've been using.
Okay.
So
we still haven't allocated the vaccine based on those groups. We're using it as we see fit, meaning we're not saying, okay, this certain number is for employees, this certain number is for patients. We're basing it on the demand that we have. Is that what you're asking? Is that clarified?
Yeah. Well, and I've been hearing that other hospitals have been told that they're being allocated vaccines from the state specifically for use on people who are 70 plus. It's being given to them with the understanding that it's going to patients. And I'm curious if you've heard that from the state as well.
Not that I'm aware of.
No.
We're taking it sequentially. Healthcare workers, now it's opened up to age 70 and above. So if we have vaccine, it's going to those groups. Yep.
Yeah.
All right.
Now, are the fitness center employees that got vaccinated, are those considered healthcare workers? Just to make sure I was understanding that properly.
Yes. Yeah. Okay. They've all been offered. Yes. Mm-hmm.
All right, everybody. We appreciate your time today. We will get back to you. We've recorded this. We'll get back to you with the numbers and appreciate you jumping on with us today.